Carolina, hundreds of students have been told to stay home as measles cases continue to rise in 2 counties. Joining us now is Dr. Kristen Moffitt, an infectious disease expert at Boston Children's Hospital. Always great to see you, Doctor.
Hey, Dr.
We
Moffitt.
appreciate you.
It's great to see you. So I'm gonna say a number, which and please frame it for me, because the CDC says that there have been 44 outbreaks already in the United States this year. There are 339 million people in the country, so 44 seems minuscule. But what can you tell us about this number?
The number of outbreaks really is representative of what's almost 1,600 cases of measles now in the U.S. And I think when we're talking about the current outbreak in South Carolina, the concern there really has to do with the exposures that have happened in schools. So 5 cases in this recent South Carolina outbreak were announced to have occurred in schools where vaccine coverage rates were very low. So hundreds of children were exposed. In one of the affected schools, the vaccine coverage rate was less than 20%. In another, it was 85%. The recommended vaccine coverage rate for an outbreak to be contained is greater than 95%. And that's because we know that 2 doses of the MMR vaccine provides excellent protection against infection. But in settings in schools like that with very low vaccine rates, the number of cases could really skyrocket. And so quarantine is really the only way to prevent that from happening.
To nip it in the bud. That's the play, right? Gotcha.
So most parents and even some doctors, they've never seen a measles case in person. Do you think that's part of the problem? People just aren't identifying these infections quickly enough?
I think that may be part of the problem, but not necessarily all of it. I think part of the issue is that indeed measles has been declared eliminated in the U.S. since 2000, and that's really due to excellent uptake of the recommended vaccines and the effectiveness of the MMR vaccine. So many healthcare workers even who have entered the healthcare field after the year 2000 haven't seen a case of measles. So many people are under the impression that getting the measles may not be a big deal, and that just could not be farther from the truth. So far this year, over 1,000 children have been infected with measles. 3 children have died of measles this year, which is an outcome that as a pediatrician for 20 years in the United States, I couldn't have even imagined. And of young children who've had the measles, 1 in 5 of them have needed to be hospitalized, largely for respiratory support. So I think it's a combination of people perhaps not recognizing it, but really not recognizing the seriousness of this infection.
We have reported on what's going on in the state of Texas. There have been some outbreaks there. We're reporting tonight on what's going on in South Carolina. Here in Massachusetts hasn't seen a single case of measles this year. To the best of my knowledge, if that's still true, if that's not true, please correct me. But if there is an outbreak, how are schools here supposed to handle it?
Yeah, no, that is true, Ed. So far, Massachusetts has not had a documented case of measles. We do have excellent vaccine coverage rates, but there are some pockets where the vaccine coverage rates are below that recommended 95%. So it's certainly possible that a case of measles in a school of Massachusetts could absolutely spread. And the importance of keeping those vaccine coverage rates high is because measles is so unbelievably contagious to unimmunized and susceptible individuals. So really, quarantine is your only way to control it. So schools are prepared, really good in early communication between healthcare workers, departments of public health, and affected schools is critical here, and identifying students who may be susceptible and would have been exposed and having them quarantine for 21 days, which sounds like a lot, and it is, but measles has a really long incubation period, so it can take a long time from when a person was exposed and became infected for them to ultimately show symptoms. So imagine how disruptive that could be, a 21-day quarantine, but schools are ready.
All right. Thank you so much, Dr. Moffitt. We appreciate you. Thank you.
Always great to see you, Dr. Moffitt. Thanks for your time.